Good evening. My name is Katarina Berza from the Council for Health and Development in the Philippines. Council for Health and Development was established in 1989 as a national organization of community-based health programs that began in 1973. My presentation is Privatization amid the COVID-19 pandemic. This short presentation aims to discuss how shrinking government prioritization on health furthers inequality and gaps that push the system to a breaking point long before the pandemic hit. Decades of socioeconomic and political upheavals have had direct and indirect effects on people's health. As economic divides persist, wealth gaps continue to reinforce health inequalities to a point that such predicament becomes a dangerous condition for millions of people in the Philippines and across the countries. Health inequalities, in turn, embeds further income and wealth cleavages as they directly impinge upon the human capital of the poor and the vulnerable population. The Philippines has a long history of an ailing health system. Being a largely agricultural country with no basic industries, debt-driven with an import-dependent and export-oriented economy, the public healthcare system mirrors the poor socioeconomic conditions and is at a constant crisis, pushing it to the brink of collapse. The issue of inaccessibility and more catastrophic health events are starker as government responsibility to public health shrinks. A social health insurance scheme did not provide the needed protection as a health market innovation aimed to deliver health service packages but failed to resolve people's increasing out-of-pocket payments. As a result, the current health system remains as it was decades ago. Curative, specialist-oriented, urban-based, commercialized, doctor-centered, hospital-centric, Western-oriented, and fragmented. All these results to being unable to respond to the needs of the Filipino people then and more so during the time of this pandemic. It is not surprising, therefore, that when the first COVID-19 virus hit the Philippine shore on January 30, 2020, the poor suffered the most from the consequences of a health system that was heavily dominated by the private sector. The Philippine health budget has been poorly funded through the years. Compared to other government flagship projects such as Build, 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 which seeks to fund roads, bridges, and other public worth infrastructures, health budget always takes a backseat. Thus, low health and contingency budgets prompted billions in foreign loans and over-reliance to donations from the private sector. From March 2020, the Philippines' foreign loans have ballooned and totaled to $9 billion. From years of neglect, extremely poor governance, and the hailing of policy of privatization of health structures and institutions, it was not surprising that the government was not prepared to provide the armor to its health workforce. Were it not for donations from the private sector, including concerned individuals who didn't have much, but still managed to contribute for PPEs, our health workers would have been completely overwhelmed from the beginning. However, the Filipino spirit of collective help or bayanihan will not absolve this government who relied on private sector donations and involvement amid lack of supplies and infrastructures such as PPEs, test kits, and vaccines. For the year 2021, the budgets for health, information technology, health facilities enhancement program, human resources for health, and institutional capacity management, and the epidemiology and surveillance program, as well as the operations of national reference laboratories, suffered major cutbacks. It is very ironic that these budget slashes were decided on while in the middle of a global pandemic. And because of a devolved health system, the local and national governments work on their own in securing private contracts instead of using public money to create, support, or develop public health infrastructures. Only in the Philippines, maybe, private research firms declare parallel COVID-19 data and trajectories in the media. This is another concrete example of the lack of government investment to public health infrastructures. 66% or 2 out of 3 laboratories are concentrated in just 10 provinces and located in urban centers. 125 of these laboratories, or 40%, are in the capital, in Metro Manila, while 28 provinces still lack an accredited laboratory. An additional 3 provinces still lack a public testing facility. For those who were tested in those provinces, they would have to send the testing samples to the nearest city or province which has their own testing facility. Due to this situation, RT-PCR testing is expensive and can reach to as much as 3,360 pesos. That is relative to the daily minimum wage, which is 537 pesos in the National Capital Region alone. Antigen or self-testing is not officially recognized despite these products flooding the Philippine market. In this slide, moreover, majority of the 310 accredited testing laboratories are private, as you can see from the chart. 53% of the accredited laboratories are private. This includes labs from the Philippine Red Cross, which the government also pays for its services. In terms of prices, there is a higher price cap for private laboratories. The Philippine Department of Health allows for a hefty 20% allowable markup, which translates to 2,800 for RT-PCR testing in public hospitals, and for private laboratories, as much as 3,360 or higher. The National Health Insurance System, or PhilHealth, provides benefits for testing mandated in public facilities, but optional in private laboratories. PhilHealth will only cover for 2,800, but the requirements are not easy as patients need to secure a medical certificate from a doctor in order to access the benefits. However, in the Philippines, public doctors are difficult to find and hardly accessible in barangays or villages. In the end, what is real is that testing is expensive, and the government still seems to be unconvinced that the only way to make testing accessible is by making it free and setting up new public testing centers and laboratories using public funds. Lastly, for vaccination, private corporations and local governments were allowed to purchase vaccines through a tripartite agreement. This means the power to negotiate prices and procurement was bestowed upon the private sector, local government units, and apart from the national government's effort. Simultaneous rollout in public and private vaccination centers are allowed. Further partnership with pharmacies and private clinics for this year, 2022, instead of building up the capacities of public primary health system in making vaccine rollouts community-based. So as you can see here, even in the rollout of the vaccination program, the private sector has a very, very big role. In conclusion, the protection and promotion of the people's right to health is enshrined in the Philippine Constitution. To achieve this, the state must ensure that it takes upon itself the primary role of providing and ensuring that the public health system is available and accessible to the people, especially the vulnerable populations. If the government fails to put premium on public health, Healthcare becomes the burden of an individual and leads to catastrophic health spending. Preventable and curable diseases drive families into crisis, and the whole system is driven at the brink of collapse. However bleak the current public health system is during the pandemic, all is not lost if the country's decision makers will choose to genuinely strengthen the public health system over privatization. A public health system with adequate budget to provide for free and comprehensive health for the people, especially the poor. A system that can weather all pandemics and value the people's needs and overall well-being. Maraming salamat po. Thank you.